I feel frustrated that Congress is that dysfunctional, and I feel frustrated that children's health insurance wasn't prioritized. The fact that they just voted last week on a bill and funding expired over a month ago, I think shows just how little they've prioritized it.
The Children's Health Insurance Program, more commonly referred to as CHIP, covers roughly 9 million children across the U.S., most by states that filter CHIP funding through existing insurance programs, like Medi-Cal, which is a state Medicaid program that can expand to include about 33% more kids thanks to CHIP. CHIP is intended to cover kids and families that make too much to qualify for Medicaid, but too little to reasonably afford health insurance. For a family of 4 in California, making $46,000 a year, which is the middle of the income eligibility window for CHIP, the monthly premium to cover a 9-year-old is $13 or less. The average monthly premium for private insurance in California is $225. One problem is that because CHIP funding is folded into Medi-Cal, some families might not realize that the expiration of CHIP means the expiration of their child's insurance eligibility. Additionally, California uses some of its CHIP funds in separate programs for pregnant women, especially undocumented women who are ineligible for Medicaid because of their status. Well, I sort of went into the system and could only make it so far because I'm not a California resident. But it says that you apply to enroll, and then based on your application, it'll tell you if you or your children are eligible.
Yeah.
But do families necessarily understand that their child is maybe made eligible solely because of CHIP?
Probably not. I'd say at least a third of my time is working on CHIP, and potentially to the detriment of other projects that I care a lot about and are really important, because CHIP is such a big deal that we need to defend it.
CHIP receives joint funding from the state and federal governments, but not in equal amounts. In 2016, the federal government contributed almost $2.5 billion in CHIP funds to California. California contributed less than a quarter of that amount. Since it was established in 1997, CHIP has enjoyed bipartisan support, but the funding renewal bill that just passed in the House by the Republican majority would extract funds from other public health programs in order to offset the costs of CHIP, which Democrats criticize as leveraging children's health insurance as a political tactic to further gut the Affordable Care Act.
We can talk about dollars, we can talk about families impacted, but I think ultimately the peace of mind that CHIP and Medicaid bring to families, I think is unquantifiable.